If I had to describe Tinker, I would say that she's a tomboy. She's really active. She loves to horseback ride.
I practice pitching and batting with my dad or my mom. I just like to run around with my dog. She's a little Caterpillar. Her name is Callie.
Oh, she loves water sports. She wants to be the first to go like on the four-wheeler or the jet ski.
She's an outdoors type gal. TJ and I were headed to town for a dentist appointment that day, and Michelle was at work, so I picked her up from school and we started town, and she said she didn't feel good.
We were about halfway there, and I just have to say that my side started hurting really, really bad.
So we went back, and that evening was pretty normal. Just she didn't have any more pain. She didn't complain anymore, and I thought, well, maybe it was just something that passed.
When we did my homework, I started kind of getting the cramp in my side again. So of course I went to my mom's bedroom and I started laying down, and it got constantly worse.
Or she complained and grabbed her side. And I can tell when Tinker's in a lot of pain, and I knew then that she was in a lot of pain. And we both did.
Yeah.
There was time to load and go.
When Tinker came into the emergency department, of course, one of our biggest concerns for her was managing her pain. That was her chief complaint. We were also able to provide the testing to rapidly identify that she had an emergent condition.
We have an expert that was comfortable with taking care of a situation like this, Dr. McKeever, a urologist, and called him in on the case, and he came immediately.
McKeever came in and said that, you know, she's got a kidney stone, you know, and he brought me back to his office and we looked at it and he said, that's what's hurting her so bad.
It was around 9 millimeters, which is about ½ an inch, which is big. It's not coming out. The stone was so big that it blocked her exit of urine. The urine could not leave the kidney, so everything backed up. And that in turn let bacteria, specifically E. coli, so she ended up with E. coli infection, which is a very serious bacterial infection. So that started spreading into her body.
Her fever started to rise, and it kept rising and kept rising, and he said, we need to go in and put a stent in and get the infection out.
I felt very scared because, of course, I've never had surgery done on me or anything, and I was like, oh wow, this is something I've never gone through. This is something that I don't think should happen to a 9-year-old like me.
This is really an emergency situation because once you have E. coli in your system, it can actually kill you very rapidly. So we really didn't have a lot of time in this situation.
All of a sudden there were, we probably had 5 or 6 nurses in there, and it was just, and she knew that whatever we were doing was for the better.
The first step was to just relieve the blockage with surgery, but the stone was still there. So they had to figure out a way to get rid of the stone, and eventually used sound waves, which is called lithotripsy, which causes the stone to disintegrate, and then you can basically get rid of it yourself. It was something that needed to be taken care of right away, and it was really fantastic that we were able to accomplish that here at Shannon.
The hospital was so good. The right equipment was there. The right people were there. The right doctors were there.
I'm back to my old sports, horseback riding, playing outside with my dog. I am now a Miracle Kid, which kind of changes the schedule a little bit. Raising money, helping out kids in the hospital so they can get new stuff that they need for Shannon from the Miracle Network.
It's the equipment that they used to put the stent in. It was just purchased by Shannon with the help of the Children's Miracle Network.
She's a Miracle Kid because we went in there, into Shannon, got all of this done, and left there, and Tinker's 100% now.
Just donate, because you're helping a kid in need, and you're helping them get what they need. Please support the Children's Miracle Network and help a Miracle Kid like me.